and reducing waste. That's a very, very layman's example. But on the other hand, you can sort of see how, for example, the AI has been used goldworm you can actually image it. Using those images, they've been able to save a lot of economic costs. And it was a small case study, but then on the other hand, trying AI of the NIH and the WHO as well. So that's like, I think it was, because the AI was able to pick it up better than radiologists. And cardiac disease and phenomenal case studies. And also the neurons. And the reverse part of that has been used to train them so that they don't have too many movements that are unnecessary. So they've gone back to the data from quadriplegic patients in the past, and then they've collated that data to predict learning techniques for training these quadriplegics, because that has been also published. So I'm a researcher, so I go by published studies. So if I keep quoting published studies, and that's why. There's also other, of course, a lot of these applications that I'm talking about, the cons of it, is that there's a lot of heavy computing involved, right? So the cloud space, and then being able to do the modeling and the statistical part, and then integrating all of these. So these become very important. And so now a lot of these smaller startups, like a company called Lightbox, for example, it's a smaller startup that's trying to go into India, to Africa, to look at, I think he's trying to do a couple of, it's mostly for cancer, but they found out, so what they do is they've collected a whole lot of doctors to be able to be part of their feeding the radiological images. So they have like, it's a one-stop shop kind of thing, and they're developing apps, and I think the doctor can sit in one place is what they're hoping to achieve, and then look at all of these AI-generated analysis of the same patient from different radiographic images, and be able to let them know what what next steps they have to take in terms of, and any kind of cancer, early diagnosis is such a, we probably talk to a lot of friends here and there, basically, could it have been detected? That's always a question we always ask. And in places like where there's not enough radiology technicians, like in the underserved populations of the developing countries, and this could be an efficient tool that could be integrated. Again, the cons of that uses a lot of time. And remember that 1/3 of the world is still not connected. That's the other thing that we remember is also that the brain actually uses less energy than computing tools. But that's something that you have to work out, because I think the best and all of that, I'm not going to talk about all that because I'm sure somebody else will. Yeah, there's always these, panic and the peril part of it, but at the same time, the possibilities, right? And the possibilities, I think, outweigh the perils. Some other examples, I think, are also in villages, EKG, well optimized, but then connecting it and making it available cheaper to, so there are some places where there's more incidence and prevalence of stroke, either by ethnicity or by geographic area. And if you could identify that using the unsupervised AI, and then go into supervised AI where there's at least a doctor maybe for 10 villages who can then be trained. Of course, there's a lot of training involved, because if there's no training, then you don't have that connect, the right connect to do the diagnosis. So those are kind of important as well. And then for women's health, we've already talked about women's health, but in women's health, the availability of supplements for the breastfeeding, for example, in remote areas where there's other vitamin deficiencies. You could go with data that's already published. But another thing that's very important is that in a lot of these ways, instead of thinking of AI as taking your job away, you can also think of AI as helping reduce the human factors risk, in the sense one person doesn't have to oversubscribe themselves. And then they save those man hours, they probably will save some sick hours. So you have to think about it in a broad perspective. So maybe AI can augment the existing human workforce as opposed to taking away from it. And one other thing that I also wanted to mention was that teaching these common health tools, because a lot of things can be preventable. So teaching these simple techniques of personal hygiene, like what the health education workers do. But if you could use AI to do that around the world, I think you could do a lot in terms of, it's just like using a mask in just a different way, in a very highly computed way. But then you are spreading the message. And you could also maybe help prevent misinformation, like, spreading the right message, with the healthcare person maybe endorsing it, and things like that.
Look, thank you. Look, thank you very much.
I think I'm done, so there's Q&A later. Thank you very much.
Sure. Thank you very much. Look, you have touched a lot of key points that I wanted to touch, and I think that the Q&A will help us bring more light onto it. But in the meantime, I'm going to just go around and get everybody's initial insights into the topic that we're discussing today, and then we will come back for a Q&A. I believe that the mic is now with Njideka.
Awesome. Thank you. Thank you.
Njideka, thank you very much for being here today. And looking at your background, I see. Excuse me, can you all be on mute, please? Can you be on mute if you're on here?
And specialty care to patients in the DMV region. This topic is very, very geared towards, because our patient population is mostly minority as well as immigrant. So you can see where the intersection is when we're talking about trying to improve healthcare in developing countries. So I'm very excited to be here, and I've learned a lot from the earlier speakers. I'm always excited when I'm asked to speak about digital technology and healthcare. And that's because of the improvements and possibilities that are always available on the continent that I see where we can use AI and other digital technologies to actually improve and, like you said, Lalita, augment care. As a physician who has been practicing in the diaspora for over 3 decades, there's no week that patients or someone doesn't come to me to ask, about how we can improve the patient or relative or a family member or friend on the continent. And so it's really important that we find a way to extend and improve care and access to care and quality of care. And this experience is no different from other physicians and health workers here who get asked the same question. Digital technology can help improve maternal and child care, infectious diseases, as well as diseases. And there's been a lot of investment in medical artificial intelligence, and over $6.6 billion was spent in 2021 just on medical artificial intelligence. And it's projected to save about $150 billion in healthcare costs by 2026. In looking for solutions towards achieving the UNGA78 3 goals, using AI, generative AI, and digital technology, we should focus on augmenting, like you said, augmenting what exists and not just recreating something new, or attempting to start from scratch. And the main pain points that I see in trying to improve healthcare is based on 2 areas: access to healthcare and quality of care. And so that's really where I'm going to focus my talk today. And I wanted to begin by telling you a personal story. About 18 months ago, my brother collapsed in my village in Delta State, Nigeria. He had to be rushed to a hospital. And I found the physicians there to be very competent, but they were limited in the kind of care that they could provide because they lacked the medications and also they lacked the diagnostic equipment that could be used to save his life. So what did I do? Using telemedicine, I was able to work with his physicians to provide second opinion consults to help manage his care. Unfortunately, he passed away, but it led to me asking and thinking about the possibilities that could have provided a different outcome for him if we had the appropriate technology to be able to actually extend care and improve the care that he got. Digital technologies such as telemedicine and second opinion consults can help improve care and access to care in the continent. An NIH study done in 2000 showed that there were about 65,000 African-born physicians in the diaspora and 70,000 nurses. And why am I talking about this? Because policymakers have said that the migration of healthcare workers and physicians is really a critical factor to the way care is provided on the continent. So what should we do now? What should we do now to improve care? I think that's where we all want to be focused. How can we use digital technology to do this? Right now, I'm just here to tell you that AI, generative AI, and also digital technology has become a game changer in the healthcare industry here. And it's embedded in the work that we do daily to care for our patients. As a family physician and geriatrician, we use it every day in our work. Gen AI has been used to improve the customer journey map in physician practices. And many of the computer technologies and digital tools we use daily have inbuilt AI capabilities. It's very commonplace in the care provision that we have. For example, in the hospital setting, it's used in the ICU to help analyze data. And for us in primary care, we use it a lot to basically determine what kind of care and what will be the best outcome and treatment for patients. So it's really important that we continue to leverage these technologies that we already have in helping to manage patients. It's already available. So what we need to do is how do we extend it into the African continent to improve the care that is already there? And it's what I call a solutions-driven approach. So right now, there are many people who are working on several platforms to help do this. And I actually am working on one myself with a team to be able to leverage and provide such a solution. But there are many other companies out there apart from me who already have telemedicine platforms that can be retooled to help extend and provide a second opinion consult that can help care for patients on the continent. And then, the problem of access to care is then addressed. Another area, and I think you mentioned something earlier about it in terms of diagnostics when you talk about radiology, is in the quality of care. One of the greatest pain points we have on our continent is about the quality of care that is provided. AI and Gen AI-driven technologies can be used to help deliver and standardize care delivery, and it will help improve and save lives on the continent. And I'm very proud to say that on our continent now, even earlier on this morning, we're talking about the talent that we have. We have raw talent. We have youth that have the knowledge to be able to deliver, just like you would have anybody in Silicon Valley. We also have a lot of tech companies already on the continent in Kenya, Nigeria, and South Africa, some places. There's been a rapid growth on technology companies. In the health tech space, we have many companies that build several solutions and platforms to help address quality of care delivery, especially in the area of diagnostics. AI technologies have already been used to assist doctors in radiology, which Lalito was talking about earlier. And this has already been done in areas of infectious diseases. The DG of the WHO will be speaking more about pulmonary TB, which is something they want to address. And we're already using it in Zambia and Tanzania. And there's so much data already on that here in the US and in other developed countries. So extending that into the African continent is already being done. And also in diagnosing COVID-19 pneumonitis. So also it's being used to diagnose diabetic retinopathy. AI technology has been used to detect fake drugs. And if anyone is here knows, it's a big problem on the African continent. We have a group of Nigerian students who used MIT open source software to develop an app to be able to do this. And you know that that's really a big pain point, especially in Nigeria, where I come from. And AI technology has also been used in medical laboratories to standardize care provided in diagnostics and in areas of helping to diagnose several diseases. So we need to focus on also trying to see whether we can build our own data, which is more Africa-centric. So there are a lot of people who are already working in the space, and one company that I'm very, very excited about is the Africa Data Foundation. It's based in Dallas, Texas, but it's actually a startup that is run by a whole group of young African men. It's really, really interesting. And why am I excited about that? I'm really excited because they're building a data repository that is going to collect data to improve care delivery with AI-driven technologies. It will help us to foster collaborations and partnerships throughout the continent. It will also enable institutions, governments, and communities to conduct research and develop appropriate medical AI to help manage patients and drive policy. So this is really good because we know that we need to have the data. This is what we're looking to for the future. We've talked about what we can do now. This is for the future. And although we have a lot of barriers on the continent, we still need to harness what we have now to be able to improve healthcare, right? Some pain points that exist that we need to work on for the future include providing and improving interconnectivity on our continent, increasing the adoption of electronic health records to enable us to get that data. We all want the data, but if the hospitals are not using it, if you're not actually entering your information into the electronic health record, this won't work. So we know that we have the technology here. We want to make it more Africa-centric, so we need to increase EHR adoption. We need to improve infrastructure and power the technological innovation and increase every country's investment in medical AI so that this can be deployed on smartphones, and because this is more easily available and is projected to actually increase by 100% over the next few years. Finally, in terms of governance, I think someone mentioned that earlier today when we're talking about women and trying to help our countries move forward with that. Our policymakers must enact laws and policies that will guide the application of the technology in healthcare and protect citizens. So I'm going to end by saying that it's important that we harness what we have to improve the quality and access to care using AI. And this is to help our brothers, sisters, as well as our parents. And as the global icon, Paul Farmer said, there's no life that is not worth saving. So thank you very much for having me. I'm going to entertain questions at the end of
Thank you.
Yes.
Thank you very much. So thank you very much. You have shared a wonderful, this is a wonderful presentation, and the insights that we're getting from this is unbelievable. I'm looking forward to the questions that we're going to get at the end of the day to see how we can really connect the everyday medicine and the everyday life with the fantastic things that our speakers are speaking about. I'm going to go ahead and yield for the gentleman to speak from a data specialist perspective. And let's see how all of that can reconnect to our expectations and how we can get value from all of this. Thank you very much. Gentlemen, you can go ahead. Thanks.
Really pleased to be here, privileged to be here. My name is Adosa Odaru. From a background standpoint, educationally, I'm a computer scientist. I have a background in economics, in innovation and business, and in technology as well. In terms of my professional background, so a background in data. I've been in the data space pre-AI and from 2022 Gen AI as well, pre-data science, and I've been doing this for close to 30 years. Industry-wise, I've been in multiple industries. I've been very fortunate more recently to have been in healthcare and in healthcare insurance very specifically as well. And prior to that, I was also on the board of the Health Data Research Institute of the UK, HDR UK. So very fortunate to have that sort of background and have backgrounds in other industries as well. So privileged to be here. I think what I want to add to the things that have been said, as opposed to repeat them, there's been a lot of talk about use cases, and there's numerous use cases that can be contributed to this conversation. But I think the bottom line is that it's got to be about how we get there. And so I want to focus a bit of my attention on that. So the other thing about my background that I must declare as well is that I'm also an author, so I've got published 2 books on data, most recently a book about driving data value, actually called Value-Driven Data. So I want to just start by just saying to everyone that much as it's easy for us to look at the lack of care and the lack of data and the lack of all the different obstacles that we see in Africa and in less developed countries around the world. There is, I suppose, real opportunities to actually make things good. And one of the big ones I'd say is that because of some of the things you've heard from us at Dr. Utuji and Alita, we have an advantage in that in innovation, there are two ways to make progress. One way is to be radical and to invent things yourselves. Another way is to be a second mover and to do something that some countries have done pretty well, which is to leapfrog. And interestingly, I know that Africa is behind in many ways, but there are examples of situations when this specific thing is not just theory, it's actually happened in Africa, in Nigeria. Now, I'm not speaking specifically about healthcare in this case, because it's a very simple example I think most people will resonate with, which is to do with how the infrastructure around telecoms and telecommunication has rapidly evolved in Nigeria as an example and across Africa as well. So when I grew up, in my growing up days in Nigeria, where I'm originally from, there was probably about less than 1 million phone lines in the entire country of over 100 million people. So you can imagine that there once wasn't a huge amount of communication actually going on. But fast forward to today, and Nigeria is one of the highest, distributions, if you like, of mobile phone technology, far, if you like, almost at par with a lot of Western countries. And that's all happening by leapfrogging. We haven't actually gone through the same journey, the same stages of evolution as the rest of the West has done from a telecom standpoint, but have managed to get to a point now where there is a lot of communication going on. Nigeria is one of the biggest users of likes of, social media platforms like Twitter and TikTok and the likes. You would never have thought that in those days actually forward. So there's a huge amount of hope, and because there's endless numbers of use cases of data and AI actually delivering within healthcare, but also within food and food security around the world, especially in the West. There's hope really that we can take some of that technology and literally, if you like, as some people would say, using Excel, just copy and paste it, right? And literally take that same technology and bring it into Africa. I know it's not as quite as easy as that. There are quite a number of obstacles. Some of the obstacles include, like we've already mentioned, some to do with infrastructure. Maybe even bigger than infrastructure would be areas of culture and policy making. But they're not insurmountable problems. They're things that with focus, we can actually get there. And I think that, I'm very encouraged that even having this kind of gathering and this kind of conversation means that we're taking this a little bit more seriously. But I think if we were really to get there, we need to focus on 3 key things. So my focus in terms of my data experience is on value. I think I mentioned that already. And I think we need to refocus on value. Like, what is it all trying to benefit? And by that, I'm not talking about only what monies and what financial benefits can be had from AI and data, but actually the non-financial benefits as well, especially when it comes to the value of life itself. Now, I think there's insufficient work around really understanding the value proposition around data and AI. And, I think just focusing on that in itself might help shift culture and policy towards the sorts of things that are going to promote artificial intelligence and data in Africa. But beyond that, I think it's really important that we don't paper over the cracks around what the real obstacles are. I think those need to be really focused on. And a lot of times when we deliver data, when we deliver AI, it's about not so much about the solution itself, even in the West, there's situations where billions and billions are invested, but very little actually comes out of it. And that's a lot of times because there's insufficient focus on what are those things, what are those barriers actually standing in the way of very clear value that could be had. And I think that is an area that I really encourage us to focus on. So I mentioned some of that already in terms of what those obstacles are, but a lot of them are very focused on specific use cases. As an example, we can talk about what policy action we're looking for from governments, but a lot of healthcare and a lot of agriculture actually sits within the private sector. And so we've got to be thinking, how do we incentivize the private sector to actually act in a slightly different way? One of the pieces of work I've been fortunate in doing was actually to rethink the model of care. And really I really enjoy sort of the things that Dr. Duji was just talking about just now. But actually, a lot of times when we talk about care, it's almost a last resort. There's been a huge amount of, if you like, early warning that we've missed along the way. Can we catch things before they become chronic? Can we catch things pre-chronic? Can we look at the data and actually use AI to predict a path that a person, if you like, who fast forward 10 years is probably going to be at? And that's an area, if you like, I like to think about this in terms of, almost two states. One state which is kind of your wellness state, and another state which is kind of your illness state. And I think a lot of times people are crossing that line before we find interventions. Can we intervene in the early stages of wellness and use data that we're collecting, whether it's the data we've looked at in the West or whether it's data we're now collecting using Africa-centric EHRs? Can we use that to model and actually look at those trajectories and actually catch things at those early stages, which not only do they improve quality of life, but also, guess what, also have financial benefits. So there's a huge amount of opportunity around that. But I think it will be really unwise of us to look at these things around data and AI without contemplating some of the big challenges or the big risks that actually these technologies bring. Some of them Lolita has mentioned, but I think it's important for us to know that without real focus and intention, we can actually end up in a much worse state. I know that sounds ridiculous, but a much worse state than we are right now. Why is that? And I think the one thing that's really important for us to know about AI is that a lot of what it does, it actually scales so that when, if you like, a decision can be made between two individuals, you get a result that is effectively between you two. With AI, you can scale that same situation across the planet within seconds. And I think that's a good thing when what you're scaling is good and positive. But when what you're scaling is negative, you can actually annihilate the entire our existence. So I think for me, it's important for us to look at those, and it's important for us to think, how do we mitigate those downsides so that we actually get the upsides without down. Right? It's easy to say this, but I think one of the ways that this happens is actually by bringing people together, actually creating focus groups, whether that's at think tanks at the UN level, or whether those are at the African Union level, they actually come together to understand the real tangible benefits, of course, but also what are those risks and how do we mitigate against them. So, I mean, there's plenty more I could be saying. I want to pause for a second to see if the moderator would like to move things to the other speakers or to go into a Q&A. But I just want to conclude by saying that really, if I can summarize, I would say that we really need to focus on value, but we need to look at how can we mitigate or almost create balance, if you like, between value creation and value destruction within data and AI across healthcare, across food, but actually across all of the SDGs as well, which have implications for data and AI. Thank you.
Beautiful. Thank you very much for that beautiful presentation. Look, listening to the three of you, I'm not sure if I have the capacity, to process all of this at once. You guys are taking us 5, 6, 7 years ahead. It was beautiful to listen to what you've been doing in the research space with AI and in also clinicals and things like that from a background of someone who has a PhD and from Texas here, and to look at the medical doctor as well, who has not only been in the front line ensuring that Africa is also able to leverage good technology to deliver better therapies towards healthcare. You were also able to think outside the box to try to give second opinions remotely. And I'm sorry about the fact that you lost your brother. The fact that you lost him, you didn't just lose him, you have started something new to attach to his memory, and to talk about data as well, and how we have learned so much about the importance of data, and how not just generative AI, the importance of data behind it as well. So I'm going to look at how we can get someone else to give us our perspective. We have deal data here. Deal data. Interesting how we're talking about generative AI and data, and we now have somebody called deal data. This makes everything very interesting. Data is joining us from Canada, and she is from Congo DRC, and it's interesting. It'll be interesting to hear her take around what she's doing and how she's able to and what she's trying to how she's able to leverage AI for that. If you don't remember anything today, beyond this session, it will be nice to stay in touch. I believe that there are great things that we all can come together to make happen, especially listening to these great ideas and great experiences from you all. I'm going to shoot you all a LinkedIn connect and try to see how I can bring everybody together again. But let us listen to Deal Data. Deal Data, please go ahead and let's hear your point.
Hi everyone. Can you?
Deal Data, I'd love it if you can do this in a fantastic way that we can get through in maybe 5, 6 minutes.
Perfect. No worries.
Yeah,
merci. Thank you so much. Hi everyone, my name is Diodata. I'm actually in Canada, and I would like to bring up talking about the AI, artificial intelligence, and talking about the healthcare, the industry of agriculture. I would like to bring up another view coming from a perspective of as an ambassador for Congolese Young Leader, an organization that we actually work with students, with kids living in the rural communities. And my concern about these discussions, I have heard from you guys, the other speakers, they bring up very specific points and very important points regarding the importance of actually using the IE technology in order to put in place, provide tools to people, to entrepreneurs that can actually guide us into empowering our societies, our communities in having a better use of all these beautiful technology that are coming up. And I would like to emphasize on the health access to healthcare. Just to remember that actually the healthcare is not a luxury, it's actually a basic human right. Each one of us, everybody needs to have access for that. And talking about all this intelligence artificial that we can actually use in order to improve, to create a bigger amount of products so that people can have access to healthcare. I it's very important that we actually put in place some if I can take a clear example coming from other countries that they actually use, we take a use of artificial intelligence into distributing the healthcare drugs to make sure everybody, even the people that then don't have a closest access to a hospital or a central where they can get some drugs or be attended into getting a medicine that they will be needing for their bodies. It's so important that we actually collaborate with government, we collaborate with entrepreneurs, we collaborate with researchers, scientists, people that can actually put in place tools that will be actually put in place for these people living on remote areas, villages, where unfortunately, they don't have access to the healthcare facilities. And talking about the industry of agriculture, it's very important to provide help for the farmers. Imagine a farmer like working all day to making sure that he's producing the food, the amount of quantity that people will be needing. And then without the good technology, it's gonna actually come into a fact that most of the production can actually be lost or can actually be throughout. And that's so important to create ways where we can actually provide those farmer with technologies that can actually help them to distribute the food into villages, into very places that are very far from the city, are very far from getting access to food and stuff like that. I can take a short example from Kenya. Kenya, they actually use a very beautiful tool that provide with the farm drive. We call it farm drive. It actually provide a way to deliver a food, to deliver products to people that they actually live very far and they can have access to this kind of products in order for us to eliminate the hunger, because it's one of the SDGs United Nations goal that we need to actually think about that. And just to wrap everything up, it's also for me, it's kind of like if I can say, it's a concern, because using data and all these applications, all these intelligence artificial, I have a concern about in Africa, we need to make sure that we actually have people that will be willing to use those technology. It's a beautiful thing to bring them up and to put them in place, but we need to maintain the capacity of using them and just make sure that they are being used in a safe way, and just to make sure as well that people have the trust that they need to have in order for people to also collaborate, because we need to collaborate with people, with the government, with partnership, with researcher. Like, it's a bunch of people that need to come together in order for us to collaborate and just make sure we as for the people that gonna be using, for example, talking about the healthcare, we know there is some places where they provide like mobile apps where people can have access to a doctor or someone that can help them remotely. Just make sure that we actually we have the safety that we will be needing in order to secure the informations, to secure all the information that will be grabbed with the data analysis, and just to make sure that people feel safe and we can use it in the good way.
Beautiful. Thank you very much, your data. You have spoken well, and it looks like we all, even if we're looking at things from a different perspective, you're all trying to solve problems. And one good thing that we're all doing here that works for me is the fact that we're all analyzing the problems properly. I have a belief that if you analyze your problems properly, you've solved it. I'd rather spend 99% of my time analyzing the problem, just to ensure that by the time I apply the solution, it works. There's one more person I want to quickly hear from in another 5 minutes before we now throw the questions out, because we need to wrap up in about 15 to 20 minutes max. Now I want to hear from our last speaker, Dajani, who will speak to us about something that sits right at the core of innovation, and how AI can also be leveraged in that space. We really want to hear what you have to say, Dajani, and the floor is now yours. Take it away.
Thank you very much. Assalamu alaikum, everyone. Very nice to be here with you all. Can you hear me?
Loud and clear.
Great. So I'm going to be brief and to the point and kind of summarize a lot of the stuff that was spoken, and to take us home with something practical that we can do. First of all, I like to introduce myself saying that I wear 5 scarves. I do 5 things. I'm a mother, I'm a teacher, I'm an educator, and I'm a scientist, a social entrepreneur, and somebody who defends human rights. And the reason I talk about all those 4 when I introduce myself is to remind us of the multiple roles we need to play as scientists in order to make change around the world. AI is allowing me to talk to you across the ocean and everyone else. So, and the pandemic accelerated, with all the negative things about the pandemic, accelerated us connecting to each other. So there's a silver lining for everything. And it's change that actually prods us to keep on going. So the question is, what do we do with the science, these discoveries? Like every scientific discovery, artificial intelligence is one of them, those advances. We can use it for bad, we can use it for good, which begs the question, who is taking those decisions on how to use artificial intelligence? Step in ethics, right? Ethical boards, ethical institutions. And the challenge with ethical institutions is that most of them are actually, majority are coming from the global north, for lack of a better term, and really truly does not represent everyone around the globe. And I'll give just a simple example. In the ethical boards for stem cell technology, or the ethical boards for artificial intelligence, are there Muslims on that board? And Muslims constitute 1.7 billion people, for example, just to give an example. And they're not limited to countries that are majority Muslim. You have people from different religions all over the world because of refugees and migration. So these will be potential patients, physicians who need to understand how to use the advances in artificial intelligence within their own value system. And this is important if we want to tackle the issue of artificial intelligence in an equity way. Which brings me to my next point, that how do we need equity, meaning we need everybody to be at the table, but not just as tokens, right? We're here at the UN Science Summit, but are we really taking the decisions, or are we just on the side ticking boxes? We got them, they're there. No, we want to be a power that is reckoned with, that people perk up and listen to us. And that's not just because it's nice or it's good or it's moral, it's because that's how you do better science. But with the more people you have, the more diversity you have. And this is basic ABC from evolution. If we want to reflect nature in our work, when you have diversity, systems evolve better. There's a more chance of discovering things. Working in silos in science in the past and technology went so far, and now it's showing that it's not enough. And we need everybody's voice to be on the table. And that leads us to the other thing about artificial intelligence is people talk about it taking us away from our humanity. How can we be more humane? But I see it, yes, human-human interaction is fundamental. That's how we survived as a species. We're social creatures. However, again, artificial intelligence is a tool. We can use it for different ways. If we can use it so that humans can be freed from doing mundane things and actually unleash their curiosity, which is another fundamental survival trait that we have lost because of industrialization, where everybody's like a robot doing things, losing their intrinsic motivation, their love of exploring and learning, which leads them not to be happy, which leads to other problems. Through artificial intelligence, maybe this is a chance to reimagine how the world works so that we can come up with systems where people can unleash their imagination, their creativity, which we need because of artificial intelligence. And this is not the first time, by the way, technology has created a change in society. If we go back to the 1920s, which nobody was, I don't know if anybody here in this panel is alive then, people, when you called across, you would call somebody and they would relay your call to someone else, even in your little town. And then electronic transfer boards came and all those people were out of work and everybody thought it was the end of the world, but then they shifted. So this is an opportunity to be more creative and more to come up with new systems to harness that potential in a good way. And then this leads me to I'm coming to is how do you do that, right? So we need collaboration. And when I say collaboration, it means not just, again, the token global north, global south. It's really working together. And because of all these examples you have in this panel of people from countries in Africa who are in diaspora. So there are many networks of diaspora. How can we harness those networks of diaspora to work together? So last year, right at this time, co-aligned with the UN Science Summit, we launched the Global Conference for Science Diaspora all over the world. The report will be coming out this month. And it was a network of networks of diaspora from Nigeria, Georgia, Jordan, the Arab world, Spain, France. Everyone has diaspora everywhere. How can we harness that so we have transfer of knowledge, collaboration, and helping each other? So I urge you to pull on your diaspora to make a difference. And mentoring, right? How do we work intergenerational? How do we inspire our young generation? So we have a mentoring program that we developed for female. There was a session before us about female scientists. One of the things they need is role models who look like them, dress like them, speak like them, and mentoring. So there's a mentoring program called the 3 Circles of Alimat, which I urge you to look at. I'm going to end with one very important thing, which is when we think of changing the world for the better and achieving the Sustainable Development Goals, which is why the UN is coming together today. And we know we're not on track. Actually, scientists produced a report that just was published last week about the science, how scientists look at achieving the Sustainable Development Goals. They pointed out 3 very important points about governance, about solutions, about measurement. However, they forgot one very important thing. If you're going to change the world, you need government for policy, you need business and private sector for money and funding. You need scientists to have the time and the capacity and knowledge and skills, but you need civic society. And nobody mentions civic society because in the end, all what we're doing is to improve people's lives, the masses. Those are civic society. And if we come up as scientists with a solution using artificial intelligence, it's not us who's going to implement it, it's the people. And so we need to work with the people on the ground to come up with solutions that we as scientists can assess, can make better, but who the people will actually deliver. And so without that 4th, very important component, we won't be able to really achieve the Sustainable Development Goals. And we won't be doing science, not just for the sake of research, but for the sake of humanity as well. So I just wanted to point that. And remember that the first step in creating these partnerships and collaborations is to build trust among the different stakeholders across generations, across cultures, across religions. And when we have trust, then we can come together as a society to make a difference. And I'm going to point out to one very important network that I urge people to join. There's the global, like I said, network of diaspora. It's called Loungy, and people can email to ask about it. And the other one is a network of social innovators around the world that includes scientists as well as people on the ground and government and funders, which is called Catalyst 2030. Thank you very much, and fantastic to be with all of you.
Thank you very much, Dajani. And I must say, let me address you properly, Professor Dajani, and I must say thank you for your time, and to try to connect to you culturally, I'd say shukran. Right. So look, today we have heard from everyone. Thank you for everyone physically out there joining us today in this one of the major side events for the UN General Assembly for the Science Summit. It's been great today. I have one question for everyone here, from the top to the last person that has spoken. I'd like to find out one thing that stood out today is the word collaboration, right? Collaboration. And if you look at that word collaboration, it will mean different things for you from when you look at it from the cultural perspective, or from what walk of life you're from, what discipline you are. My question today, and I want to go in a reverse order, is what does collaboration look like for you? Because stepping out of this event today, as we end in a few minutes, it would be lovely to move with some actionable steps. What does collaboration mean for you, Professor Dajani? And now I'm going to move in a reverse order. Thank you.
Perfect. Yeah. So collaboration to me practically means that everybody on this panel and this day, these 3 sessions that I heard, somebody who piqued my curiosity for me to reach out, send them an email and set up a Zoom meeting and to explore together what we can do together, to have the courage, the boldness to do that. Even if it ends up we're not doing anything, we know about each other. The time will come when it's ripe, when we need each other. And that's how you start that collaboration and that trust to make a difference together.
Thank you very much. I already did that, by the way. I sent you a message on LinkedIn and I connected to you. Let us collaborate from here. I'm going to move to Deodata now. Deodata,
Yes.
what does collaboration mean for you? How would you like to move on from here? And what kind of collaboration would bring more meaning to what you are doing out there?
Perfect. As a Congolese young leaders ambassador, for us, collaboration is really like getting into people that have the tools, have actually what we lack. I mean, provide us with information, with material that we will be needing in order to actually put in practice all these points that came up today, that we talk about the artificial intelligence, because we need, after this event, we actually need to go out there and start putting them into practice. And for that's where the collaboration's gonna start. And for me, collaboration is people coming together with the same objective, same goals, and trying to find solutions and creating a space where everyone can speak up and come into a conclusion. Thank you.
Thank you very much. In case I forget to mention, if you're trying to connect with anyone within this event, if you're not able to reach them afterwards, please reach out to the organizers and they might be able to connect you to anyone. For me, I have been connected to a lot of people today as well. You can reach out to me. I might be able to put you in contact as well. I'm going to move on to the great Edosa Odaro, the British man who has come all the way to give us a lot of insights into what data and AI can do. That's a massive collaboration in between those technologies. So leveraging collaboration here, what does that sound like to you? And how would you like for us to move on and create some value from here?
Thank you. Can you hear me?
Oh, we can hear you.
Oh, you can hear me. Okay. So I think for me, collaboration is such a, it's almost a cliche word. It's kind of out there, but you can think about it mechanically as just bringing people together. And I think we're doing it right now. We're, in some ways, we're collaborating right now. But I think if you were to take it to the next level, I think the collaboration is really about a few additional steps, if you like. So first, I would say that collaboration is genuinely listening to each other and really being intentional about that listening. It's not just about being present, which we are all doing. And I thank everyone for sparing the time. But I think genuinely listening, and that is really where you start to connect with each other. And really one of the things that I think, for me, I personally am part of the work that I do, is to really advocate for people to connect with people, even when there's no alignment. So a lot of times we like to speak to people of like minds and like this and that, but I think that a lot of times the value actually lies in this alignment, listening to those very difficult things to hear, and trying to empathize and actually see things from a very, very different perspective. And I think for me, that's where you start to get to the point of potentially getting value from collaboration. And then I think finally I would add that you then want to look for a way to connect and to act. And that to me is what collaboration means.
Thank you very much for sharing that. And like I said, and like I've done, leadership by example, I already connected with you as well on LinkedIn. So we're going to take collaboration from there and see where we can take it to. I'm going to go straight to Dr. Njideka now. And I'm going to ask you as well, like, what does collaboration mean to you? Because you have talked about a lot that is going on in Africa and how you are, spending some personal time of yours trying to look for how to make things better out there. I'm not sure you were in the session yet when myself and Dr. Alamelu were having a conversation around precision medicine and the rest of them. So moving from here and ensuring that we get value from here, not just attending and moving on, what will collaboration mean for you and how do you want us to get involved with whatever it is that you're doing?
So for me, collaboration is encapsulated in a famous African proverb that guides the work that I do, which says that if you want to go fast, you go alone. And if you want to go far, you go together. So that really is the way that I work. In order to make an impact, especially if you want to deliver an impact to a large population, you have to be willing to work with others. You have to be willing to be open. You have to be willing to be able to, think outside the box. Just like Edosa was saying, sometimes it's even, reaching out to people that you don't think you have alignment with, and then finding out ways in which you can work together, even learn from them. So I think that it's really important for me and for all of us today that as we lead, that we connect and we continue the conversation and to find ways to leverage the information that we've gathered today to try and make an impact. It will be something that will be a mistake if we leave here and nothing is done about what we've learned today. So it will mean reaching out, continuing the work that we're doing and trying to find ways in which to impact the society and the continent we love. Thank you.
Thank you very much. Look, like I said, I already shot you an invite on LinkedIn as well. I see your profile. You're doing a fantastic job out there, Dr. Njideka. I'm going to move on to Dr. Alamelu Sundaresan from Texas Southern University, which is a great place, by the way. I remember mentoring a hackathon event there sometime in 2019. And I love the work that you guys are doing out there. That's the bedrock of collaboration, I would say. For you, what does it sound like? How do you want to be involved in everybody else's project? And how do you want us to connect with you as we leverage the word collaboration from here?
You almost tried to steal my thunder. Everybody created a very nice segue. I'm going to piggyback a little bit. She was piggybacking off me for a bit. I'm going to piggyback off her a little bit, and maybe him too. She made a good point saying that a lot of African diaspora students are embedded, especially in all our universities and the HBCUs, especially where there's also a lot of computer science. She brought that up too. So what I'm going to suggest is that they also have these Africa Studies programs as part of the study abroad programs. They're embedded in every university. So since you all know about some of the universities out there, I think what we need to do now is maybe create viable theses projects and dissertation projects where we involve interdisciplinary collaboration, where you actually maybe try and maybe I could connect with you, Doctor, and we could use our high performance computing center and some of our AI people there come up with a research project I could co-mentor with you. And then we could actually make them do projects that can then translate later on into the actual maybe. So teach, try, and then succeed. Teach, try, test, and succeed. Maybe add one more. Do the test as well. So I think maybe if we can come up with real viable projects. For example, you could be for example, the IRB person, come up with something that you want done. We use the AI capacity here and maybe do some in vitro physiology work based off of that, and then connect it with the Africa Studies program, get some funding for the students, and maybe some other grants that we have that we could pull in, and then make it viable and make it a continuum. Because I think a continuum is what really fosters collaboration, because otherwise, then, without, and no man can live on an island or checkbox.
Beautiful.
But
Beautiful.
I think since Dr. Oscaretti is in contact with us already, and there's other HPCUs that we also collaborate with, so we can sort of like start something concrete, I think, and then go from there. So I think, yeah, let's continue the conversation. I'm all for that. Yes.
Beautiful. Beautiful. Thank you very much, everyone. Look, this is wonderful. Today, not only did we come together to share our opinions and share our perspectives and find insights in what every other person has presented, we have ended up deciding to move on a collaborative front and let collaboration become our North Star. That means that we're getting great value from here. And I imagine what this collaboration will look like 6 months from now as we begin to look at the possibility of solving problems of humanity. Thank you very much, guys. I'm going to give a few minutes to the conveners of this event if they want to say anything. Dr. Osaretin and Olanrewaju, if they want to say anything at this point as we shut down. Thank you very much, Michael, for attending. And please connect with everyone if you can. I see that you're attending from Germany. Let me know if there's anybody in particular you're trying to connect to as well. And I'm happy to connect you to that person. This is truly the United Nations because we see representation from all around the world. I'm going to wait to hear from Dr. Osaretin or Olanrewaju if they have anything to say. Okay. All right. It looks like we're not hearing much from that side. But anyway, thank you very much, guys. Okay,
Hello.
Dr. Osaretin is here. Let me put you on the spotlight. Thank you very much. We'd like to hear from you. And I'm going to yield to you now. Thanks.
All right. First of all, I want to thank all the speakers, those speaking online, and those who are also here in person. Sincerely, it has been a wonderful opportunity to have many of these great minds here in New York. And just like the United Nations General Assembly, such events like this is also happening in other places. There's an avenue for us to talk about some of the challenges that we are facing in the world and to find solution for it. That is why we're having a session like this. And not also forgetting that immediately after this session, we are to put up a report and send to the United Nations so that that can also be used in planning for the world of the future, which is 2024, the mandate. And I want to also thank every participant, those online, those who have also come to join us in person in this event. And we want to say on behalf of the team, we want to say a big thank you to everyone. And it's not just ending, just like every other regular event. So this is something that comes to stay. So we see the same on faces in 2024, 2025, 2026. We're going to talk about how we can actually use the newest technology, which is AI, in making the world a better place. Many persons might feel that AI is going to replace some jobs, replace some things that be done by humans. But from what some of the speakers have also spoken, talked about, and other researchers, we're not going to do that because all cost soft skills. So it means that if you don't have those, the computers, like the robot, they don't have the soft skills to adapt to situations. It means that it's in humans to manage some of these things. So it's not in here. We are trying as much as possible to continue doing this. And for those who are working for this event, we're going to have a post event. That means that after today, we'll have some other event before the end of the year, before September. And like we all know, UNGA78 is every September 12 to 29. So it means that these events you are seeing today, we're still going to have it 2024. But before then, we'll have series of events, both online and person here in New York and some part of Africa. And once again, I want to thank everyone who have come to join us, especially our speakers, because it's been a long journey, right? From May, we have been trying as much as possible to shoot these emails and all of that. And also the moderator, good job. You've really done a great job. And for me, I'm grateful for all that we have done today. Because I know at the end of this section, we are also giving our own thought. We're also sharing our own concept about how we can make the world a better place. Because it's if we don't talk about it, I don't see who is going to talk about it. So it's essential for us to talk about it so that the young ones can know that we are also making our impact based on the experience that we have gathered from our various careers. Thank you very much.
All right, thank you very much for sharing that vote of thanks with us. My name is Dayo again. My name is Dayo. I'm a founder of a tech consulting firm called Cloud and Prem. I'm here in Houston, Texas, and I have tried to connect with everyone. What I'm looking at, or how I imagine things go, is that we will reconvene here next year and be talking about the impact of our collaboration. Thank you all, everyone, for joining online and offline, and those that were able to make it in person. It was great. And again, without the AI, we were all great people, because I see all your backgrounds, and I was very happy to moderate this session, to be in the midst of very intelligent people. And now with AI, it's time to spread our wings and fly. So guys, I'll see you in the sky. Let us connect, let's collaborate and get things going on. Thank you very much and good evening.
What is my time?